A startling statistic shows that 67% of medical errors are due to deficiencies in teamwork and communication. Dr. Jen Arnold from Johns Hopkins All Children's Hospital is back with her team. You're about to see them in just a moment to show us how they embrace keeping patients safe and conduct continuous hands-on training. Good to see you again. Good morning.
Thank you.
Yeah, wait till you see the team that was brought in today. But before we get into that, this is so interesting, and I love that you and your team are kind of owning the fact that, yes, there are hospitals, there are teams that make mistakes. Nobody's perfect.
No. Medical errors.
Talking about how you're combating that.
Yes, that's sort of the heart of what I love about simulation training is that it's all about trying to improve what we know are the leading causes of medical errors. And what I think most people don't realize, patients, families, is that when mistakes happen in medicine, it's not a lack of knowledge or skill on the part of our clinicians. Everyone's very well trained. They know what to do. But typically what happens is it's a deficiency in teamwork and communication, particularly during a crisis, that can lead to an error happening. So, it's not intended to happen, but mistakes do happen when you have a large team of multidisciplinary providers in a very high-risk, stressful situation. And so what we've learned is actually the same lessons that have been already learned in aviation.
This is fascinating to me. And
yes.
In fact, you guys are taking skills that the aviation, team is already doing.
Yes. Aviation realized, 20, 30 years ago that when plane crashes happened, the majority of the time it was not a weather issue, a mechanical issue, not a lack of knowledge or skill on the part of the pilots, but rather a deficiency in teamwork and communication between the whole team, the whole crew. And so they developed a type of training called crew resource management, which really tackles those teamwork and communication skills to help teams work better together in a crisis. Well, in healthcare, we found about 10 years later, we have the same problem. Medical errors happen because of those same deficiencies, and we don't get to practice how we work together as a team traditionally, except for in real critically ill patients.
Unfortunately, as a that's not when you want to be learning and trying out those techniques.
No, and doctors go to medical school, nurses go to nursing school. We all train in silos, and then all of a sudden you're in the hospital setting, you're an experienced provider, and you have to work together in a crisis as a team, and we don't always do a great job of communicating. So that's where I think simulation can really help those crew or crisis resource management skills.
Well, and I feel like the medical field in general is going towards this trend of prevention is key, right? Everything from health and how we feel and how we treat our body to now this. And let's get to this team and kind of the setup that you brought in this morning.
Yes.
Because this is this is pretty unique that you guys are doing.
Absolutely. We're really fortunate at Johns Hopkins All Children's that we have a lot of support for developing a robust simulation program, which the really best value in training is not necessarily just the technical and the knowledge skills, but now the teamwork skills. And so we have teams that come through the simulation program and they rehearse high-risk crises like a resuscitation, a code, a cardiac arrest, and they get to hone in on their skills and how they work together as a team, those crew resource management skills.
Can we go ahead and kind of see what you brought in this morning? This morning the simulation is a baby, which you always, we love to see who you bring in this morning. So kind of explain and kind of direct them on kind of what we should be seeing here.
Yeah, so what you're about to see here is a neonatal resuscitation. So we have a baby in for example, the neonatal ICU, the critical care unit, who is being monitored, admitted for some reason, maybe respiratory issues, and then all of a sudden decompensates. And when that happens, the team has to respond quickly.
Explain what that is. That sounds awful.
Yes, it's where maybe the baby stops breathing. They turn blue. They're going into a complete cardiac arrest. And so the team is now going to rush in. They're going to have to assign roles. So someone's going to take the airway. Someone is going to monitor the baby's heart rhythm. Someone else may be giving medications. And it needs to be a team leader that's directing that whole team in what to do and how to handle that crisis for that baby. And so that's where the teamwork skills really do come into play.
And there does need to be a leader, does there not? I mean, someone needs to kind of be able to say, the last thing you want in a crisis situation is going, who's making the calls here?
Exactly. And that's oftentimes, again, one of the examples we see of errors. Maybe you have two doctors in the room that might both be acting as a team leader, and then it's confusing to the team members who to take orders from. So that's where this type of training, we can really identify specific roles, get comfortable with those roles and no longer have those errors happen.
You know, we're also talking about it being Patient Safety Awareness Week, and as patients, as we wrap up here, what do you want families and people to know? Because it can be a scary thing, I think, to go into a hospital setting. You know, what advice do you have for them? What's the take home today?
My take home message is, you know, Patient Safety Awareness Week is about making awareness for the institutions to embrace safety culture and behaviors like training like this, but also for the patients and the family members to really take ownership of your own safety. Don't be afraid to ask your nurse, your respiratory therapist, your provider. If you have any questions, you should know everything that is going on. You have to be your own patient
advocate. I have learned that the hard way, I think, over the years. And you say that's okay.
That's okay. I mean, doctors, nurses, we welcome that because we don't want to make mistakes either. And so the more people that are double checking,
I think people are nervous about that, though, because I think they feel like they're kind of challenging, you know, the authority of what their expertise is.
Absolutely. People are afraid. I mean, I've been a patient my entire life. It's sometimes scary to say, hey, are you know, what medication is that? Or is that right? I hear a noise, or I'm worried about, you know, this feeling that I'm getting from that treatment. Don't be afraid to ask. You're your best advocate, and all good doctors and nurses should welcome that questioning, because it helps us all deliver the best care we can. That's all we want for patients, is to get better and to stay safe.
Dr. Jen, we love when you are here. We really do. You're always educating us, and thanks for bringing the team in here as well. And we look forward to seeing you again soon and seeing what else we're going to chat about and show, and who else you're going to bring in.
Yes, thank you.
All right, up next.